All right. Health Saver CPR, first aid. Doing all right today, Miss Mariah?
I'm doing great.
Got your book. We got our CPR dummy. We got our AED. We have all our tools we need. Now we're about to start going over the video. Any questions you have for me before we get started?
No.
All right, so with the CPR class, you are a massage therapist, correct?
I am.
Awesome. Happy to have you here.
Thank you.
Thank you for
Thank you for having
participating.
me.
Oh, you're so very welcome. So pretty much, we're massage therapists, so we understand healing. So now we're also in the process of if anything happens in the room while you're with the client, or if anything happens while you're out in public, maybe you can help breathe life into the victim or the client, however it goes, and use the tools you're about to have talk to you today.
Okay, that sounds great.
Awesome. Let me get us started here. I really appreciate you coming out today, man. It really means a lot.
Still feeling tired and groggy. A customer ran up to the counter and asked, "Does anyone know CPR?" The man had collapsed outside on the patio. Suddenly, I was wide awake. I didn't have formal training in cardiopulmonary resuscitation, that's CPR, but I had learned some skills from the American Heart Association website and from scouting when I was a kid. At first, I was nervous, but there was no time to waste. Somebody needed help now. Outside, the adrenaline kicked in like a shot of espresso, and I knew exactly what to do. The customer had collapsed in a patio chair. I'll never forget his face. It was pale as a piece of paper. He wasn't breathing, moving, or responding. While someone called 911, I lowered the man to the patio. I remember thinking, I have someone in my arms who is dying, so I started CPR. I put both hands on the center of his chest and just started pushing, hard and fast. I kept doing chest compressions and breaths for about 2 minutes until medical help arrived. After medical help took over, I washed up, had my apron on, and went back to serving coffee. But for the rest of my shift, I wondered how that customer was doing. Later, I found out he was a 66-year-old man named Mike. He survived his cardiac arrest and is doing well. I also found out that most people who witness a cardiac arrest either don't know CPR or are afraid to do it. So, they call 911 and then they wait. Medical help gets there as fast as they can. But in the United States, it still takes an average of 4 to 10 minutes for them to reach someone in cardiac arrest. That means receiving CPR from a bystander is a person's best chance to survive until medical help arrives. It also means any CPR is better than no CPR. My career goal is to be in law enforcement and to do search and rescue. But you don't have to be a medical professional to help save a life. By learning hands-only CPR, you too can be ready to help someone in cardiac arrest. It might even be a friend or a family member whose life is in your hands. On your next coffee break, why not take the time to learn hands-only CPR? Well, I hope it helps.
What would you do if someone collapsed suddenly in front of you? Although Kurt stepped up and helped someone he didn't know, you are much more likely to be in a position to save the life of someone you know and love, like a parent, child, spouse, or friend. Today, you'll learn the skills to help respond in an emergency, but that's only half the battle. What would you do if you were standing in that line for coffee? Would you have the confidence to act? Cardiac arrest can occur without warning or within just a few minutes after symptoms appear, and it can occur in both men and women. However, recent studies have shown that in the United States, women are less likely than men to survive a cardiac arrest, as are underrepresented groups such as Black and Latinx communities when compared with their white counterparts. So it's important to remember that cardiac arrest knows no gender, race, or ethnicity. And in a cardiac emergency, everyone needs CPR to survive. Welcome to Heart Saver CPR AED, presented by the American Heart Association. An emergency can happen anywhere at any time, and this course will help prepare you for the types of emergencies you might encounter. For information on additional topics not covered in this course, please consult your student workbook.
Okay, cool. Sorry to interrupt your class. So, was there anything you needed to get from inside here? You want my fan?
Cool.
No.
Okay, so that way when she's done, we can just escort her out.
Oh.
Thank you.
Right, so that was the introduction there. And now we're gonna go to adult CPR and AED.
Okay.
So now we're about to look at the difference between heart attack and cardiac arrest.
Today, you'll learn CPR, how to use an AED, and other life-saving skills. To help you along the way, your student workbook covers
Was there any questions you had so far? Good.
all the material and includes quick reference guides. We recommend you put these guides in your first aid kit for easy access during an emergency. If you complete all the course requirements and demonstrate the skills correctly, you'll receive a course completion
This
card.
is yours.
Keep in mind, though, that studies show you should frequently review the course information and practice these skills to maintain your ability to respond to a cardiac arrest. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, the terms don't mean the same thing. But when and how do you provide CPR? Has the person had a heart attack or cardiac arrest, and what's the difference? Cardiac arrest results from an abnormal heart rhythm. This abnormal rhythm causes the heart to quiver so it can no longer pump blood to the brain, lungs, and other organs. Within seconds, the person becomes unresponsive and is not breathing or is only gasping. Death occurs within minutes if the person does not receive immediate life-saving treatment. A heart attack occurs when the blood flow to part of the heart muscle is blocked by a clot in a blood vessel. If the blocked vessel is not reopened quickly, the heart muscle normally nourished by the vessel begins to die. Heart attack symptoms may include discomfort or pain in the chest, or an uncomfortable feeling in one or both arms, the neck, the jaw, or the upper back. Other signs of heart attack are shortness of breath, breaking out in a cold sweat, nausea, or lightheadedness. For both women and men, the most common heart attack symptom is chest pain or discomfort. However, women are less likely to seek treatment for a heart attack. This may be because they're somewhat more likely than men to experience some of the other common symptoms of a heart attack. These symptoms include shortness of breath, nausea, vomiting, and back or jaw pain, which they often mistake as symptoms of acid reflux, the flu, or normal aging. A heart attack can lead to cardiac arrest. A person in cardiac arrest needs CPR to survive. CPR stands for cardiopulmonary resuscitation and consists of two parts, chest compressions and breaths. When CPR is needed, chest compressions can help blood get to the brain and other vital organs. It's natural to hesitate or to question yourself when faced with an emergency. There are many myths about performing CPR. Myth number 1, true or false? Many Americans are prepared to act in an emergency. False. Most Americans feel
Definitely false.
Really?
Yeah, I don't think most people are prepared for that. That's why 911 is so busy.
What is it?
Because people just aren't prepared for a state of emergency.
So shouldn't they offer more schools and break?
I feel like they should offer it more in school.
Mm-hmm.
But that's why we do the class.
helpless to act because they don't know how to perform CPR or are afraid of hurting the person. Unfortunately, less than half the people who need CPR get the immediate help they need before advanced help arrives. Myth number 2, you can hurt someone by giving CPR. Even if someone doesn't need CPR, you're unlikely to hurt someone by providing it. Although it's possible for a person to receive injuries like a broken rib, these injuries are minor compared with death. Survival rates drop by as much as 10% for every minute that a person does not receive CPR. Doing something to help someone is better than doing nothing. Myth number 3, You can be sued for performing CPR. All 50 states have Good Samaritan laws in place to protect people who try to help save a life. For more information on Good Samaritan laws in your state, check your state government's website. Myth number 4, true or false? AEDs should be used only by healthcare professionals.
What do you think?
False.
The excitement builds.
False. AED stands for Automated External Defibrillator. AEDs are safe and easy to use by anyone. We'll discuss AEDs in more detail later. For now, all you need to know is that to operate one, you simply turn it on and follow the prompts. An AED will only provide a shock if the person needs it.
The AED pretty much is just doing everything on its own. This is the AED here. Once you turn it on, it'll instruct us on what to do after it's turned on. We'll learn later the proper placement for the pads once using the AED. And then we'll go further into that.
Yeah,
Any,
sounds good.
any questions? Safety scene and responsiveness. DC.
When we go about our everyday lives and something like this happens right in front of us, it may take a few seconds to realize that this is actually an emergency. When we do realize the urgency, there are steps to follow to determine whether a person needs CPR. First, before you start providing CPR, you need to make sure the scene is safe. Look for anything nearby that might hurt you. You can't help if you get hurt too. Next, check to see if the person
Alright.
is
You can just drop this down, just right there on that paper on top of your book. Just things that'll help us once we remember what we're doing, making sure the scene is safe. Most important steps: tapping, shout out, shout for help. These are just a few steps we should follow right here.
responsive. Kneel at their side, tap them and shout.
Are you okay? Are you okay?
If the person is unresponsive, shout for help. Someone who is responsive moves, speaks, blinks, or otherwise reacts when you tap them and ask if they're okay. Someone who does not move, speak, blink, or otherwise react is unresponsive. Here's a demonstration. While leaning over the person who is down, check to see if the person is responsive. Tap their shoulders and ask,
Are you okay? Are you okay?
if the person does not move, speak, blink, or otherwise react, then they are unresponsive. Shout for help.
Help, I need help.
Gets real then. So you want to scan the scene, scan the body, tap on the shoulders, ask them if they're okay. If they're not responsive, it's time to get into business. You want to shout for help. Now we're going to learn about phoning 911.
If someone is nearby and can help, have that person phone 911 and get an AED. Say to them, you, call 911 and get an AED. If no one comes or you're alone, then phone 911 yourself and put your phone on speaker mode so that you can use your hands while assessing the person. You'll also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is, or if there isn't one available, do not delay the start of CPR. Stay on the phone until the 911 dispatcher tells you to hang up. Answering the dispatcher's questions will not delay the arrival of help. The dispatcher will ask you about the emergency, where you are, and what has happened. In general, dispatchers can provide instructions that will help you. The dispatcher may also tell you how to help the person until someone with more advanced training arrives and takes over. The dispatcher may be able to tell you how to do CPR, use an AED, or give first aid. In an emergency, the sooner you realize that there's a problem and get help, the better it is for the ill or injured person.
Any questions?
The next step in assessing the need for CPR is to check for breathing. When the person is unresponsive, scan the chest for 5 seconds, but no more than 10 seconds, checking for breathing. If the person is not breathing normally or is
That scan, it's almost like your superhuman power or something. You just want to see if you notice any movement in the chest, stomach, anything like that.
So they use my superhuman powers.
Use your superhuman powers. You gotta zone in. You gotta hone in to who you are.
gasping, they need CPR. If a person is gasping, it usually looks like they're drawing air in very quickly. They may open their mouth and move their jaw, head, or neck. You might hear what are called agonal gasps in the first minutes after cardiac arrest. These gasps may appear forceful or weak, and sometimes may pass between gasps because they usually happen at a slow rate. The gasp may sound like a snort, snore, or groan. Gasping is not regular or normal breathing. It's a sign of cardiac arrest in someone who is unresponsive.
Alright, now we'll go for a summary. I just got an email and I'm just trying to read the email at this.
Let's look at these steps all together in assessing the need for CPR. Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive, shout for help.
Help, I need help.
If someone comes, have that person phone 911 and get an AED.
You, what's your name?
Maria?
Maria, I need you to phone 911.
Okay. If no one comes to help and you have a cell phone, phone 911 and put it on speaker mode so you can hear the dispatcher's instructions. You will also need to get the AED yourself. If you're alone and don't have a cell phone, leave the person while you go to phone 911 and get an AED. Quickly return and continue providing emergency care. If you don't know where the AED is, or if there isn't one available, do not delay the start of CPR. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives. The video will now pause while you get in position to practice scene safety and assessment.
Alright, so any complaints on any of this? Okay. Good, good, good. Alright, so now we're gonna practice scene safety. So you can stay where you are, but if you can stand, I'll show you a good example of what's going on.
Can you turn it
Turn it on? Yeah, sure, we can turn it on. It's good to have light at the scene. Alright. Scene safety, we'll call him Donnie. Donnie's laying on the ground, Donnie's hurt, he's in pain. Boom. We come over. You want to look at the scene because you want to notice why is he on the ground. You want to make sure there's nothing violent that has happened. You want to make sure nobody's coming back to hurt Donnie. You want to make sure no one's coming back to hurt Donnie. You don't want anything bad happening. So you got to make sure you're safe first. And then you want to come over. You want to check the scene out. After checking the scene out, making sure the scene is clear, you want to scan the body. I see no response. Gently tap on the shoulders. Hey, you okay? You okay? No response right now, so we will go to the next part, which we will learn in just a second. So it's always make sure your scene is safe.
Scene is safe.
Scan the chest, mouth, stomach, no movement. Once you see there's no response, you want to go into CPR, but you want to say help. If you got your phone with you, you'll pick up your phone, 911, call 911, but you want to set the phone down, put it on speakerphone. So that way they can help guide you, you can talk to them through the whole process. So that way when paramedics come to the scene, they know where you are in the CPR process. As we continue the video, it'll show you that the paramedics will come in and they'll help team up. Either you'll keep going, and then they'll come in and then they'll take over the pumps. But we'll learn that as we continue watching. All righty. All righty. No complaints?
No complaints.
Before you provide CPR, check to make sure the scene is safe. Tap and shout to see if the person is responsive. Are you okay? Are you okay? If the person is unresponsive, shout for help. Help! Help! I need help. If someone comes, have that person phone 911 and get an AED. You, call 911 and get an AED. Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, you need to begin CPR immediately. If the person is breathing normally and is unresponsive, place the person on their side until someone with more advanced training arrives.
Just coming in once again, scene safety, checking the scene. Hey, are you okay? You okay? No response. Hey, someone help. Or dial 911, or you can tell someone. Usually if it's not a crowd, you dial 911, put your phone down. If there is a crowd, you kind of want to direct people, hey, call 911, hey, give me an AED. Every business facility should have an AED in it. If they don't have one in there, hopefully we start pushing that more to where we have more AEDs everywhere. I know at the other job I had, this last job I worked at, I don't think they had an AED in the building. Right, and so, I think that's something we should start doing on business codes, is making sure AEDs are in there. And you pretty much tell them to get the AED, tapping on them, making sure everything's okay. And you go, want to begin your compressions, which we will see how to do next. You're doing good, thank you. Any questions? Okay.
Not yet.
All righty.
Now, let's talk about chest compressions and hands-only CPR. Bystanders who are not trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR, if they see a teen or an adult collapse. There are 2 simple steps to follow. Phone 911 and push hard and fast in the center of the chest. High-quality CPR requires 2 main skills: providing compressions and giving breaths. Compressions are the most important part of CPR. We'll go over compressions first, and then we'll talk about breaths. A chest compression is the act of pushing on the chest. When you push down correctly on the chest, you pump blood to the brain and other organs. To perform high-quality compressions, you need to do 4 things. Provide compressions that are deep enough, provide compressions that are fast enough, allow the chest to return to its normal position after each compression, and don't interrupt compressions for more than 10 seconds. We're going to demonstrate chest compressions and then give you a chance to practice. When providing compressions, you're acting like the heart because in a cardiac arrest, it's not beating correctly on its own. By providing compressions, you're pumping blood to the brain and other vital organs, keeping them alive until advanced help arrives and the heart can begin beating on its own. You need to push hard, to a depth of at least 2 inches or 5 centimeters, and push fast, at a rate of 100 to 120 compressions per minute. Let's watch this demonstration. Then you'll get to practice. To provide chest compressions, first move the person to a firm, flat surface. Quickly move bulky clothes out of the way. If the person's clothes are difficult to remove, you can still provide compressions over their clothing.
Yes.
If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. It may seem awkward or uncomfortable removing someone's clothing, especially if you don't know them, but it's a necessary step to make sure the AED pads make direct contact with the skin. Remember, Good Samaritan laws protect people acting in good faith, so fear of legal repercussions shouldn't be a reason to not provide CPR. Place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. If you're using a feedback device, your instructor will explain how your device works. When you reach the correct depth, you might hear a click or see a green light, depending on the mannequin you're using. In a real emergency, there won't be any feedback, and you'll have to estimate at least 2 inches or 5 centimeters. You should push hard and fast, at a rate of 100 to 120 compressions per minute. Studies have shown that you're more likely to perform CPR at the correct rate if you're thinking about a song you know with a beat between 100 and 120 per minute. The Bee Gees song, Stayin' Alive, has...
I got the BG Staying Alive and also Baby Shark. That's another one.
It's a great name,
Something
and
to
it's the
think
correct
about.
rate for performing chest compressions.
So like you're
The
doing
American Heart
karaoke, doing
Association
CPR.
website provides titles of additional songs that can help you give compressions at the correct rate. Finally, you need to allow the chest to come all the way back up after each compression. This is called recoil, and it's an important step that allows the heart to refill with blood. Our aim is to minimize interruptions in chest compressions to 10 seconds or less. This is true in all situations and for everyone, including pregnant women. Do not delay providing chest compressions for a pregnant woman in cardiac arrest. Provide high-quality CPR just as you would for any other adult. High-quality CPR can increase the mother's and the infant's chance of survival. The video will now pause while you get in position to practice chest compressions.
Chest compressions. So luckily with Donnie here, like Power Rangers, you see. And then you come over the chest, make sure you're in good position. You want to have good form. You want the look? Okay.
Yes, please. So I can see Donnie.
You
Just
want to
be
see
sure.
Donnie?
Yes.
Hope Donnie doesn't get caught in the dark.
So,
Mm-hmm.
so how many?
Put that right here. So just want to practice, make sure you know what you're doing, but you'll do 30.
30.
2 breaths, then 32 breaths. But right now we're just working on the chest compression. Alright.
This might hurt him.
Well, this will be alright. We're a lot stronger than we give ourselves credit for. So once you end up getting that rhythm and pace, you want it to be like.
Oh, so I was doing it too slow.
Yeah, but right now we just gotta learn the technique first, though.
Okay.
But that's the technique. That's what we'll get to, though, and then we'll go further from there. But just want to make sure you have it. So you try it one more time.
Okay. Am I in the right position?
Mm-hmm. Alright. Perfect. Alright, so that was good practice there. And then once we do that, then it comes with the compressions after that, with the breaths. That's what we have the mask here for. And we should be getting into that soon. This is clean. I bought 2 of them, so that way you can have one to take with you. Because you will need the tools
To save lives.
to save lives. Such a true statement.
To provide chest compressions, place the heel of one hand in the center of the chest over the lower half of the breastbone, and put the other hand on top of the first. Next, push down hard, at least 2 inches or 5 centimeters. It's helpful to keep your elbows fully extended. You should push hard and fast, at a rate of 100 to 120 compressions per minute. Finally, you need to allow the chest to come all the way back up after each compression.
Yeah. Mouth to mouth.
Now, we're going to learn the second skill of providing high-quality CPR, giving breaths. Breaths are especially important for infants, children, and anyone in cardiac arrest due to choking, drowning, drug overdose, or any other respiratory cause. It's a common misconception that humans exhale only carbon dioxide, when in fact, we exhale a number of compounds, including oxygen. This means that the oxygen in your exhaled breaths is helpful to a person who can't breathe on their own. Before giving breaths, open the person's airway. Opening the airway correctly will help keep the tongue out of the way to make sure your breaths are effective. As you practice this skill today, you'll be using a mannequin. It's important to note that in this upcoming demonstration, you'll see breaths given without a face shield or pocket mask. We'll cover giving breaths with a pocket mask in our next section, but for this practice session, your instructor will provide a face shield and mannequin sanitizing wipes. Face shields are relatively inexpensive barrier devices that are a great addition to any first aid kit. Watch this demonstration and then you'll get a chance to practice. Remember, you don't want to interrupt compressions for more than 10 seconds to give breaths. To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. This simple action lifts the tongue away from the back of the throat, opening the airway. It's important to avoid pressing into the soft area under the chin because this might block the airway. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give someone a breath and the chest doesn't rise, allow the head to go back to its normal position. Then, open the airway again by tilting the head back and lifting the chin. Give another breath, making sure the chest rises. Don't interrupt compressions for more than 10 seconds to give 2 breaths. The video will now pause while you get in position to practice giving breaths.
Ready for this one?
Yes.
All right. So, put the Donnie, no, not Donnie. You want to take your hand, push the head back, lift it up with the chin, then you pinch the nose, and you're coming in, and you begin the breath. Safety first, due to COVID and everything else important. So I'm gonna let you practice on that. What you'll do is you come in, tilt the head, lift the chin, and then you come in and blow. Very unique tool. You stand back and want people to look at it. It's a lot. It's even reusable.
Oh, it is reusable.
Yeah, it's your own special one now.
That's so cool.
Thank you. I'm just gonna watch you.
So I tilt the head back.
Tilt the chin up.
Tilt the chin up. Is this too far though?
No, it should be alright.
Alright. Place this over his nose and mouth.
Correct.
And I do 2 breaths, right?
2 breaths.
Alright.
And you'll notice a little movement in the chest.
I can breathe into this.
Okay, it's safe. Let me
Mm-hmm.
see. Nice. Good
Is he
job.
breathing?
I think he's breathing, Don. You okay, Don? Donnie's all righty. It's a good job.
Wait, so how many compressions in?
So it'd be 30 compressions, 2 breaths, 30 compressions, 2 breaths. Mm-hmm. All right. Good job. None of this falls behind us. Right. Mouth to mouth.
To open the airway, follow these steps. Put one hand on the mannequin's forehead and put the fingers of your other hand on the chin. Then, tilt the head back and lift the chin. While holding the airway open, pinch the person's nose closed with your thumb and forefinger. Take a normal breath. Cover the mannequin's mouth with your mouth. Give 2 breaths. Blow for 1 second for each breath. As you give each breath, you should look down at the mannequin's chest to see it rise.
So you want to make sure when you give it that breath, you give it a good strong breath. Okay, you gotta blow good into it. You want that chest
You may give breaths with or without a face shield or pocket mask. If you're in the workplace, your employer may provide this kind of personal protective equipment for use during CPR. Many first aid kits also contain these supplies. There are different kinds of face shields and pocket masks, and there are different sizes for adults, children, and infants. So make sure you're using the right size. Pocket masks and face shields are made of plastic and fit over the person's mouth or mouth and nose. Face shields are a thin piece of flexible plastic meant to be a one-time use barrier between you and a mannequin or you and another person. Make sure that the face shield is pulled securely over the mouth and deliver breaths just as you would from mouth to mouth. Pocket masks are reusable barrier devices that can be sanitized between use. They're typically made of hard plastic with a one-way valve, and they protect the rescuer from coming in contact with blood, vomit, and contagious disease. The one-way valve is the part you breathe into. A pocket mask may not be included in a typical first aid kit, but the AHA recommends that you add it. You may need to put a pocket mask together before you use it, but this is usually as simple as popping it into shape and connecting the 2 pieces. And by the way, use the one-way valve you were given for today's practice only, and then discard it. So, let's take a look at how to give breaths with a mask. We're going to show you a demonstration on how to place the mask and give breaths. Afterward, we'll give you a chance to practice giving breaths with the mask. Start out kneeling next to the mannequin. Put the mask over the mannequin's mouth and nose. If the mask has a narrow or pointed end, put that part of the mask on the bridge of the nose, and the wide part of the mask should cover the mannequin's mouth. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. It's important to make a good seal between the mannequin's face and the mask while you lift the chin to keep the airway open. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise. As you give each breath, you should look down at the mannequin's chest to see it rise. Actually seeing the chest begin to rise is the best way to know that your breaths are effective. Remember, if you give a breath and the chest doesn't rise, you need to reopen the airway and reposition the mask to get a better seal. Give another breath and make sure the chest rises this time, interrupting compressions for no more than 10 seconds total. If the chest doesn't rise, begin pushing hard and fast on the chest again. Now we're going to practice using a mask to give breaths. The video will pause so you can put your mask together and get into place.
So that's kind of what we just worked on right there. Thank you. Voila. Just covered up. And then you do kind of hold it down. Just go all in.
Mm-hmm.
Put the mask over the mannequin's mouth and nose. Tilt the head back and lift the chin while pressing the mask against the mannequin's face. Now that you've got the mask positioned, give 2 breaths while watching for the chest to rise.
Kind of just did that. Any questions on any of this so far? Do you feel comfortable with doing this?
Yes, I'm feeling like we're confident.
That's good. Feel like you can save a life now?
Yes, of course.
Now we'll go to using the AED.
By now, you've learned how to provide compressions and give breaths with and without a mask. Let's look more closely at using an AED. An AED is a device that can deliver a shock to the heart of a person in cardiac arrest if needed. Even though you may be in the midst of providing CPR, once the AED arrives, use it immediately. CPR combined with using an AED provides the best chance of saving a life. If possible, use an AED every time you provide CPR. During cardiac arrest, the heart quivers and stops pumping blood. An AED shocks the heart so that the heart's rhythm can reset and the heart can pump blood again. To use an AED, you simply turn it on by either pushing the on button or lifting the lid. Once you turn on the AED, you'll hear prompts telling you everything you need to do. AEDs may have 2 sets of pads, a large set to use for adults and a small set to use for children. Make sure you use the large pads on anyone 8 years of age or older. Later, we'll talk about using the smaller pads for children younger than 8 years old. You may have already moved some of the person's clothes out of the way to perform CPR, but you should remove all clothes that cover the chest before using an AED. AED pads must not be placed over any clothing. It's important that the AED pads not touch anything other than the person's bare skin. Peel away the backing from the pads and attach them to the person. Follow the pictures on the pads. You don't need to remove a person's jewelry as long as it doesn't interfere with the placement of the pads and isn't in contact with the pads. It doesn't cause a shock hazard to either the person being helped or the rescuer. However, undergarments should be removed, along with other clothes covering the chest, since they often interfere with proper pad placement. Plug the pads connector into the AED and follow the AED prompts. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. If the AED recommends a shock, it will tell you to stay clear or not touch the person. If the AED tells you not to touch the person, look to be sure that no one is touching the person, including you, and state something like, "Stay clear," or "Stand back," just before you push the shock button. As soon as the AED gives the shock, immediately resume chest compressions. After this demonstration, you'll have a chance to practice using an AED trainer so that you can see what it's like. You'll need to consider a few special situations when using an AED. First, if the person has hair on their chest, the hair may prevent the pads from sticking. If your AED has only 1 set of pads, a razor should be included. You can use the razor to quickly shave the area and then apply the pads. If your AED has 2 sets of large pads, you can try this. Apply 1 set to the hairy chest, and if the hair prevents the pads from coming in contact with the chest, the AED should tell you to check the pads. If it does, press the pads down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest hair. Then, reapply a new set of pads to the bare skin. Water on a person's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the person's heart. If someone is lying in water, you should quickly move them to a dry area. However, if the person is lying in snow or in a small puddle, you may use the AED. And if the chest is covered with water or sweat, wipe the chest before attaching the AED pads. But wipe the chest quickly. It doesn't have to be completely dry. Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like a round or square lump smaller than a deck of cards. If you see this lump, avoid putting the pads directly over it. Also, don't place the pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before you put on the pad. If you're not wearing gloves, make sure you don't touch the underside of the patch. You don't want to get any of the medicine on your bare skin. Use an AED for a pregnant woman in cardiac arrest just as you would for any other person. If your workplace has an AED, you should familiarize yourself with it. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. Additional emergency equipment may be found in the AED, such as scissors, razors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit. The video will now pause to allow your instructor to lead a practice session with an AED trainer. These trainers simulate what a real AED will do, but they won't provide a shock.
Maybe. Alright, so this is what the real AED is. It has instructions showing you where to place the AEDs at. So what you do.
Analyzing rhythm. Everyone stand clear.
Okay. So that's off, that's on. So what you want to do is you want to take the AED patch. This one says to put it underneath the breast part there. I'll take this one here. Right here over the chest there. Hit that on for me. Oh.
Analyzing rhythm. Everyone stand clear.
Get back.
Shock advised. Charging. Everyone stand clear. Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
And then you get back to the CPR. You leave everything there though. And so instead of doing the breaths now, you go back.
And shock again.
Because now we're in emergency mode. So we're doing what the paramedics would be doing at this point. And so the importance is very important, but this can send shockwaves. But if certain contraindications in this that we don't do it with, you want to make sure there's no chains, no metals on or anything like
1 minute and 30 seconds of CPR remain.
See how they keep up with it. And that's pretty much it. Okay. Sound pretty cool?
Yeah.
Awesome.
Now, does they chest go up like they do in the movies?
It doesn't. It doesn't.
No.
It doesn't. But you can always customize it properly.
No.
You can do anything nowadays.
Pretty much.
And we also.
Analizando el ritmo cardíaco. Apártense.
Español.
Yeah,
Analyzing rhythm.
that's been your.
Everyone.
And so there you go with that. So after we've done 2 rounds of CPR, the 30, 2 breaths, 30, 2 breaths. Now you want to get the AED out. Bring the AED out. Place the pads on the body how the AED has shown. You want to hit the on button. Let it charge up. Once it charges up, they'll send a shock. We still are unresponsive. We're right back to it. Right back to the CPR. Give it time to charge up again. And then once it's ready to go again, let it send the shock. Understandable?
Yes.
Good, good, good. Coolio, coolio, coolio. Alright, so now we got putting it all together.
Now we're going to demonstrate how to put it all together. From scene safety and assessment, to providing compressions and giving breaths, to using an AED. Afterward, you'll get a chance to practice. First, check to make sure the scene is safe. Tap and shout to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive, shout for help.
Help! Help!
Ask someone to phone 911 and get an AED.
First steps, make sure the scene is safe. You walk in, oh, scene is safe, tap and shout. Are you okay? Are you okay? Person's unresponsive. Help, help. Ask someone, hey, can you call 911 and get an AED for me? So, scene safe, shout, see if they're responsive. We'll say tap shout to remind that. Scene is safe, tap shout, shout for help, ask someone to call 911, get an AED.
Go 911 and get an AED.
Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, provide CPR. Make sure the person is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way.
So after doing all that, you've told them to get an AED, call 911. Now you want to make sure they're not breathing before you get started with CPR. So it's almost like a confirmation look again after you've already looked the first time and saw that they were unresponsive. Now if the person is not breathing normally, you got to provide CPR. You want to make sure you're on a firm, flat surface. Say if they're like in a vehicle or something, you would pull them out the vehicle, lay them onto the street, but you want to make sure the vehicle isn't leaking gas, you want to make sure there's no fire, all of that stuff. You got to make sure the client, you got to make sure the person is in a safe area, that both of you all are safe, so that way you can complete the CPR without any distractions. Quickly move bulky clothes out of the way. Any big bulky clothes that are in the way, you want to make sure you move them. And that's about it.
Well, speaking of clients,
Okay.
so should I just take my client off the table, or can I do it on the table?
You could do it on the table, probably just lower the table down.
What if I have a portable table and I can't move it down?
Oh, then you want to, might want to try to move that client, because you want to be able to have the room you need to complete the CPR. The compressions are very important. So, you might want to just lay them down somewhere.
Okay. Good answer.
If a person's clothes are difficult to
question.
remove, you can still provide compressions over clothing.
When
If
it
an
does
AED
happen.
becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Now, tilt the head back and lift the chin to open the airway. Give 2 breaths. Remember, do not interrupt compressions for more than 10 seconds. Give another set of 30 chest compressions. Now, tilt the head back and lift the chin. Give 2 breaths. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid. Attach the pads to the person's bare chest. Follow the AED prompts and the pictures on the package or pads. Plug in the pads connector. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. Press the shock button if the AED says to, and immediately resume CPR, starting with compressions. Now the video will pause and your instructor will help you practice putting it all together.
So what I like to do, I like to go back and look at it one more time just to make sure that we get a good understanding of it.
Now we're going to demonstrate how to put it all together. From scene safety and assessment, to providing compressions and giving breaths, to using an AED. Afterward, you'll get a chance to practice. First, check to make sure the scene is safe. Tap and shout to see if the person is responsive.
Are you okay? Are you okay?
If the person is unresponsive, shout for help.
Help! Help!
Ask someone to phone 911 and get an AED.
Go 911 and get an AED.
Next, scan the chest for 5 to 10 seconds, checking for breathing. If the person is not breathing normally or is only gasping, provide CPR. Make sure the person is lying on their back on a firm, flat surface. Quickly move bulky clothes out of the way. If a person's clothes are difficult to remove, you can still provide compressions over clothing. If an AED becomes available, remove all clothes that cover the chest. AED pads must not be placed over any clothing. Now, tilt the head back and lift the chin to open the airway. Give 2 breaths. Remember, do not interrupt compressions for more than 10 seconds. Give another set of 30 chest compressions. Now, tilt the head back and lift the chin. Give 2 breaths. Once the AED arrives, use it immediately. First, turn on the AED by pushing the on button or opening the lid. Attach the pads to the person's bare chest. Follow the AED prompts and the pictures on the package or pads. Plug in the pads connector. Make sure no one is touching the person while the AED analyzes the heart rhythm and before you push the shock button. Press the shock button if the AED says to, and immediately resume CPR, starting with compressions. Now the video will pause and your instructor will help you practice putting it all together.
Alright. You ready?
Yes.
Hey, so let the instructions going on. Alright, it's a lot of light. So I'm coming in. Gotta make sure the scene is safe. I'm coming in. Make sure the scene is safe. Tapping. Hey, are you okay? You okay? I'm responsive. Hey, I need help. Can you call 911 and give me an AED? Scanning the body. And then I want to start my compressions. Sound right?
Mm-hmm.
Okay. Now, once we're getting ready to start our compressions, I want to make sure everything is safe. I'm gonna use yours. Here. Still no response. I want to get my AED.
Analyzing rhythm. Everyone stand clear.
Pads on.
Shock advised. Charging. Everyone
Back.
stand clear.
This could get scary.
Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
All right, he's breathing.
1 minute and 30 seconds of CPR.
Turn that off, and that's that on that. Seem pretty cool?
Mm-hmm.
Would you like to give it a try?
Sure.
Righty. sure the scene is safe.
Right, checking to see that scene is safe.
Hey, what's going on?
Now I'm gonna ask this, the person, is he okay? Sir, are you okay? Just not breathing,
Not talking.
not talking. Ma'am, I need to get you, call 911.
All right.
Sir, can you get the AED machine?
Yes, I got you. I'll be right back.
So I'm going to start scanning the body.
Do you see any
I don't
response?
see no response at all.
No.
So I'm gonna start compressions,
All right.
which I would do 30 compressions.
Right.
Alright. I'm gonna do 2 breaths. Gonna tilt the head and chin,
Good job.
cover up his mouth and nose, and do 2 breaths.
Good breaths.
Alright, and do 30 more compressions.
You're a pro.
Alright, gonna do 2 more breaths. Tilt the head and chin, cover the mouth and nose,
Got
2
this.
breaths.
Hey, I got the AED.
Thank you.
Welcome.
Alright. Gonna place the patches on each side.
Analyzing rhythm. Everyone stand clear.
Stand clear.
I hope he's okay.
Shock advised. Charging. Everyone stand clear.
Come on, Donnie. Come on, Donnie.
Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
Okay, do more compressions.
4, 6, 8. Good job.
Alright.
All right, you want to breathe into him?
Getting 2 more
Let's
breaths.
see if he's alive.
And he is breathing. And the paramedics have
1
came.
minute and 30 seconds of
Thank you,
CPR
Donnie.
remain.
Donnie's alive. Donnie's breathing. Thank you so much, ma'am.
You're welcome.
I'm so happy you took CPR classes. Oh my gosh. I need to go take some CPR classes now. Oh, this is beautiful. Thank you. What do we owe you? All righty, so now
We do not accept money here for saving lives.
tell the doctors that. All righty, good job. You did good. All righty. Oh, completes. Good job. Proud of you.
Now that you've had a
I
chance
think
to
I probably
practice
hit the gym today.
compressions, you can see that providing CPR requires a lot of effort. It can be tiring to keep up the pace. Therefore, if someone else at the scene knows CPR, take turns providing CPR by switching at least every 2 minutes, even if you're not tired. As you help each other and take turns providing CPR, it's important to give each other feedback. While you're resting, remind the other rescuer to push down at least 2 inches or 5 centimeters at a rate of 100 to 120 compressions per minute, and to let the chest come back up to its normal position after each compression. You've just practiced life-saving CPR and AED use for adults. The video will now pause for your instructor to test you on these skills.
Well, that's kind of what we just went over. I'm just looking for some extra information that I had put up. Perfect. All right, so very important in this. You just want to make sure you take it as serious as possible. If it's hot outside, you don't want to put them on no heated surface. You want to keep them, if you have a sheet or a blanket or if they have some clothing on, just kind of unbutton it. I mean, because you have to get to what we have to get to, which is important. Always make sure you know where you are on your compressions, because the ambulance, once paramedics come, they're going to say, where are you in the CPR processing? And they will take over at that point. Some people have done CPR for over 3 minutes, some people 30 minutes, I think even some people over an hour. It's just all about taking turns and how much strength you got to do it. So I think you'll be pretty good at this. We'll take a little test after this. On that sheet of paper I gave you, I'll give you 15 minutes, do that test, and we'll go from there. And we'll check out this next video here. Choking in adults. Interesting.
Choking in adults is often caused by food blocking the airway. The block in the airway may be mild or severe. We've all been in a situation where food or drink gets caught in our throat, making it difficult to swallow or even breathe for a few seconds. These situations are called mild airway blocks and are normally relieved without intervention. If a block is mild, a person can make sounds and cough loudly. When this happens, you may want to help, but it's best to stand by and let the person cough. If you're worried about the person's breathing, phone 911. If the block in the airway is severe, then the person cannot breathe, talk, or make sounds. The person may also make the choking sign by holding their throat. If this happens, you need to act right away to try to clear the airway. To help in this situation, you will give abdominal thrusts slightly above the navel. Each thrust pushes air from the lungs like a cough. This can help remove an object blocking the airway. If you think a person might have a severe airway block, follow these steps. Ask if the person is choking and if you can help.
Are you choking? Can I help you?
If the person nods that they are choking and can't talk, you need to act. You'll need to give thrusts slightly above the navel. Depending on your size and the size of the person choking, stand firmly or kneel behind the person and wrap your arms around their waist with your fists in front. Make sure to position yourself so that you are stable in case the person collapses to the ground. Some people find it helpful to stand with their feet shoulder width apart and one leg slightly forward. This creates more stability. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. Give thrusts until the object is forced out and the person can breathe, cough, or speak. An adult who has been given thrusts should see a healthcare provider as soon as possible. Let's look one more time at how to make a fist. Make a fist with one hand. Put the thumb side of your fist slightly above the navel and well below the breastbone. Grasp your fist with your other hand and give quick upward thrusts into the abdomen. If the person is pregnant or very large, you will need to change how you relieve choking. Put your arms under the person's armpits and your hands on the lower half of the breastbone. Pull straight back to give chest thrusts instead of abdominal thrusts. You can also use this technique for someone in a wheelchair. If you give someone thrusts but cannot remove the object blocking the airway, the person will become unresponsive. In this case, you need to give CPR, but there are a few differences. First, you'll need to get the person safely onto a firm, flat surface. This can be challenging, especially if the person is much larger than you. The best technique is to slowly walk backwards and allow the person to slide toward the floor until they're flat on their back. As you've already learned, when a person becomes unresponsive, shout for help. Phone or have someone else phone 911 and get an AED if they haven't already. Put the phone on speaker mode so that you can talk to the dispatcher. Provide CPR, starting with compressions. After 30 compressions, you will do something a little different from what you were taught earlier. Open the airway and quickly look in the mouth. If you see an object in the mouth, take it out. Do not attempt to reach in and pull anything out that you can't clearly see. This is known as a blind finger sweep. Doing a blind finger sweep may cause the object to become lodged farther back in the airway. Remember, You want to minimize interruptions and compressions to no more than 10 seconds. After checking the mouth, give 2 breaths. Keep repeating the sets of 30 compressions and 2 breaths. Each time you open the airway to give breaths, look for the object in the back of the throat if you haven't already found it. Continue CPR until the person speaks, breathes, or moves, or until someone with more advanced training arrives and takes over.
Alrighty. It's a lot right there, isn't it? I know, man.
This wraps up our Heart Saver CPR AED course. By taking this course and stepping up to help when someone needs CPR or choking relief, you are increasing that person's chance of survival. The knowledge you've gained today can help you change or even save someone's life. If you practice your skills often to keep them up to date, you'll have the best chance to help someone who may need immediate assistance when an emergency occurs. Your student workbook is a great resource, so use it to review this information between training courses. At the American Heart Association, we remain committed to exceptional training. Go to heart.org/CPR for more information on our courses and to learn more about our mission. On behalf of the American Heart Association, we congratulate you and thank you for taking the time to attend this important course.
Good job. Alright, so now having with that pencil you have and a sheet of paper with the questions on it, I'm gonna give you 15 minutes to complete that. Shouldn't be too hard. A lot of the answers you should already know. It's just pretty much going over the steps that we have to take. So I'll let you do that and we'll be done for the day.
Okay, sounds great.
Alright, it's 12:41. We should be done by 12:56, 12:57. I'll give you 12:57. I'm gonna look out for you. 12:57. But if you're done before then, just let me know, and I'll check everything, and we'll get the certificates printed up, get you ready for CPR.
Okay.
Alrighty.
Sounds great.
Alright, sounds great. Would you like some music? Or?
I would like some light.
Some light? You're big on light. I don't blame you. Light is what we need. Let's go down here. Wasn't too bad. I don't have the greatest handwriting. Alrighty. Congratulations. I just need to get you your certificate.
Yay.
I thank you for your participation.
Thank you.
Very, very welcome. Did that. Heart Saver First Aid CPR.
Yes.
Welcome to the team.
Thank
Happy to have you.
you for having me.
Very welcome.